Good morning. Welcome to another Rock County Public Health Department media briefing. Today is February 3rd, 2022. It is 11 a.m., so we will go ahead and get started. As always, we start with some updates and some information from the Rock County Public Health Department, and then we open it up to questions from our participating media. So my name is Jessica Turner. I'm the Communications Specialist for the Rock County Public Health Department. And joining me today, we have Nick Zupan, epidemiologist, and Katrina Harwood, health officer. So I will start by turning it over to Nick for some data updates.
Thanks, Jessica. So to date, we have had over 35,000 cases of COVID-19 among Rock County residents over the course of the whole pandemic. Right now, we're averaging about 160 new cases per day being reported to the health department on a daily basis. So this represents lower numbers than we've seen since last week. We're seeing pretty steady declines in case activity, but this number is still pretty high in terms of the number of new cases that are being reported. Our previous peak last year in November of 2020 was about 170 new cases per day on a weekly basis. So we're not out of the woods yet, but we are seeing some positive signs in terms of the trends in our daily numbers of case activity. We also are seeing decreases in the number of known active cases. So right now we have about 7,500 known active cases, and these numbers are dropping. There have been 295 deaths due to COVID-19. Part of this recent increase that we've seen is due in part to data maintenance and data cleanup. And the other part is due to recent deaths. We've seen about 10 recent deaths in the past couple of weeks. So still seeing people who are falling severely ill with COVID-19 infection. In terms of our hospitalized patient numbers, we are seeing a decrease in those numbers as well. So we have 40 patients in the hospital getting care for COVID-19. That data is as of Tuesday. So we are seeing pretty significant decreases in our patient levels at the hospital setting. These numbers are still high, and we'd like to continue to see these numbers continue to fall. In terms of our vaccination efforts, we have over 63% of the Rock County population having received at least one dose of the COVID-19 vaccine, and about 60% of the total population have completed that original 2-dose series of the COVID vaccine, and about 30% of the population have received a booster at this point, which is just under 60% of those who are eligible to receive a booster. So that's all I have for a data update this morning. Thank you.
Thank you, Nick. We will now go to Katrina, and Katrina will give us some additional COVID-19 updates.
Thank you, Jessica. Today, we're focusing on the importance of staying current on COVID-19 vaccinations. Right now, it is critical to be both vaccinated and boosted for a variety of reasons. We know that the Omicron variant is more transmissible than past variants. In fact, Omicron is more than 4 times as transmissible as the Delta variant, and it evades immunity better than Delta. When a variant can travel at that speed and spread exponentially, it is incredibly hard to control. By the time someone knows they're positive, they have likely already infected a number of others who then go on to infect other individuals as well. Additionally, as long as the virus keeps spreading, it will continue to mutate, creating more variants in the future. One thing we can do to help slow this process is to get vaccinated and to stay up to date on additional doses and boosters. Individuals who have received a booster dose are not only less likely to contract the virus, but they are also much less likely to experience severe illness and death. According to the CDC, from October through November 2021, weekly average deaths from COVID-19 per 100,000 people were 7.8 deaths for people who were unvaccinated, 0.6 deaths for people who were vaccinated with no boosters, and only 0.4 deaths for people who are vaccinated and boosted. Vaccination, and especially vaccination plus a booster, makes a difference when it comes to protecting your health and your life. So please get boosted and stay up to date on your vaccinations. Booster doses increase protection against COVID-19, and individuals that are up to date on all vaccinations don't have to quarantine when they are identified as a close contact, as long as they are not showing symptoms of COVID-19. Booster doses therefore help keep our businesses and community open. Everyone aged 12 and older are eligible for a booster dose if it has been at least 5 months since they received the second dose of a 2-dose vaccine series, or 2 months since they received a Johnson & Johnson vaccine. Teens aged 12 to 17 can only receive the Pfizer vaccine as their booster. For those 18 and up, the Pfizer or Moderna vaccines are preferred in most cases. Rock County has many locations available for people to receive COVID-19 vaccines. The Rock County Public Health Department offers vaccines on Wednesdays from 3 p.m. to 7 p.m. at 3328 North US Highway 51 in Janesville. You can schedule an appointment at rebrand.ly/rcphd-covid-appt or phone 608-757-5440. Walk-ins are also welcome. The Rock County DHS Community-Based Vaccine Clinic at 1900 Center Avenue in Janesville is open Tuesday through Friday from 11 a.m. to 7 p.m. and Saturdays from 11 a.m. to 3 p.m. For more information, visit vaccinate.wi.gov. Walk-ins at this location are also welcome. AMI and various Rock County providers are also traveling to other locations to make vaccination accessible and easy for everyone. Some of the upcoming mobile clinics include Milton High School today from 3:30 to 6 p.m., Northside Intermediate School in Milton on February 5th from 10 a.m. to 2 p.m., and Blackhawk Technical College on February 8th from 12:30 p.m. to 5 p.m. Vaccinations are also available for people who are unable to leave their homes. For more information or to schedule a vaccine, call the Rock County Public Health Department at 608-757-5440. For additional information about any of these vaccination sites or to find additional opportunities, visit rockcountyshop.com. If you need a ride to a vaccination appointment or a walk-in site, you can call 211 for transportation assistance. We want to remind everyone that community spread is still high and the Omicron variant is more contagious. It is recommended that everyone, regardless of vaccination status, continue to wear a mask whenever they are in public indoor settings. Wearing a mask that is tight-fitting, so it does not have gaps, and covers both the nose and mouth, make the mask more effective. We are also encouraging everyone to stay home and get tested if they are exhibiting any symptoms like severe headache, sore throat, stuffy nose, fever, or cough. If you aren't sure where to get a test, you can choose from one of the many testing sites and options by visiting our website. Simply visit rebrand.ly/rcphd-covid-testing. We are relying on everyone to take responsibility for their own health and the health of those around them. Please quarantine if you are not up to date on your vaccinations and have been in contact with someone who has COVID-19. If you have symptoms or test positive, even if you are vaccinated, isolate and notify the people you've been in contact with. With continued precautions, including vaccination, wearing masks, and staying home when sick, we can continue to protect ourselves and our community. I'll pass it back to you, Jessica.
Thank you, Katrina. We will now turn it over to questions from the media. It looks like we have one participant today. We have Austin Montgomery from the Beloit Daily News. So Austin, we will give you the ability to mute and unmute, and you can go ahead and ask any questions that you have.
Thanks, Jessica. Just wanted to touch base, just have a few questions here. Just based on what Nick had said, I just wanted to kind of ask this. Are we beginning to see the kind of tapering down of cases caused by the Omicron variant? Just wanted to see, because I know at the last briefing, we'd kind of projected out into February of when that was starting to possibly trend down, and just wanted to see if that trend was starting to happen.
Yeah, thanks for the question. I think the data right now is favorable in terms of the trends that we're seeing and the level of decreased case activity on a daily basis. Like I said, we're still in a period of pretty high disease transmission, unfortunately. So we're not out of the woods yet, but we are moving in the right direction. So 160 cases per day is still pretty high, relatively speaking, to what we've seen previously in the pandemic. But based on what the numbers are showing and what the data is showing on a daily basis, it looks like we're kind of on the back end of the peak of the Omicron case activity right now.
Thanks, Nick. Appreciate it. Next two questions are related to vaccinations. First off, does the health department track school-age vaccination data for Beloit and Janesville, or is that something that the data is only available in terms of like county-wide? I was looking on the vaccine dashboard today and had only seen kind of like the breakdown of the ages related to Pfizer and Moderna vaccinations on that dashboard, and just wanted to clarify if that data is something that's tracked by the school district.
So we do have data, and kind of by school districts. The caveat that I'll offer is that we only have data based on someone's home address in terms of their vaccination status. So we try to plot out on a map of the entire county where people are getting vaccinated and where people live who have been vaccinated. And so we do have that data divided out by school district. The reason I mentioned the address and how we locate people is that it doesn't necessarily reflect the school district's level of vaccination coverage because of open enrollment and students potentially attending a private school or attending a different school than the district in which they live. So we can share that. I can send you an email with the link to that map. It's available on our website through the school dashboard, but it might be a little bit trickier to find. So I'll send you a link so that you have access to that data.
Thanks, I appreciate that, Nick. And then just the last question, where does the health department get that information? Is it from DHS where that vaccination data comes through? Just wanted to see how the health department kind of received just day by day vaccination numbers.
So the data comes from a system called the Wisconsin Immunization Registry. So anytime someone is given a vaccine, whether it's for COVID or for the flu or any other type of vaccine, the vaccine provider is required to enter the information into the Wisconsin Immunization Registry. So we pull that information on a daily basis every weekday to update our vaccine dashboard. And on a weekly basis, I will take that information and plot the data on a map and try to identify the vaccination coverages by school district and also by census tract across Rock County.
Thanks, I appreciate it. That's all the questions I have today, guys. I really appreciate you guys doing this, as always.
Thank you, Austin, and we really appreciate your participation. So thank you so much for joining us again today. So that will conclude our media briefing today. Again, this is live streamed on our Rock County Health Department Facebook page. The recordings will be available on the Facebook page and on our YouTube channel afterwards. If you are a member of the media and you would like to participate in these media briefings and have the opportunity to ask us questions live, feel free to send an email to media.publichealth@co.rock.wi.us, and I can send you the information that you need to be able to participate in these briefings. So thank you again to everybody who has been watching the live stream, everybody who will be watching the recordings. And of course, thank you again to Austin for participating today. And we will see you again in a couple of weeks. Thank you very much, everyone. Stay safe and stay healthy.